Hi, everybody. Dr. Ryan here, board certified specialist physician. Thank you so much for joining us or joining me in our fifth didactic approach. We're talking about hemoptysis. If you haven't yet subscribed to my channel, what are you waiting for, man? So, hemoptysis, simply put, is coughing up blood. Ooh, yucky, right? And the first part of call when someone comes in with hemoptysis is you could ask yourself, is this true hemoptysis? Which means, is the blood truly coming from the respiratory tract or is it coming from elsewhere? Where else can the blood be coming from? Well, if you got hematemesis, the patient could be vomiting up blood, could have epistaxis, which is a nosebleed tracking back the nasopharynx, dripping down to the oropharynx and being expectorated out. Right. If you have established this is true hemoptysis, question number two, is it massive? Meaning more than 400 mils or massive enough that requires resuscitation. If the patient's hypotensive, tachycardic, you may want to start up an IV fluid infusion. You might want to transfuse the patient's blood, back red cells. If it's not massive and if it's true hemoptysis, right, then you do history and examination. So you're asking questions about fever, constitutional symptoms, weight loss, previous TB, right, risk factors for bronchial carcinoma, risk factors for autoimmune disease or features of autoimmune disease, right? Also, examine the patient, okay? Then chest X-ray is the most inexpensive, the most logical next modality. There are many different outcomes on the chest X-ray. First up, if you're dealing with a mass, you're thinking, okay, if the patient has clubbing with hypertrophic pulmonary osteoarthropathy, other features of lung cancer, could it be a lung malignancy? Or could be a metastatic lesion to the lungs from elsewhere? Could it be an abscess, which is basically a cavity with an airflow level, and the patient often has, halitosis and clubbing, not always. Aspergilloma is a fungal ball inside a cavity. Okay. The next logical investigation would be a CT thorax. Tissue is the issue, right? So you want to get yourself a bronchoscopy and try and do some biopsies. If you're dealing with a consolidation or a pacification, here in sub-Saharan Africa, TB is endemic. So you've got to think about TB. Could be pneumonia, could be an abscess, a lung abscess, could be an autoimmune etiology causing interstitial lung disease. It could be cardiac, and there may have cardiogenic pulmonary edema. Then you want to do your sputas, then it offers some kind of nucleic acid amplification test. For TB, you can do a gene expert, you can do your acid fast bacilli, do your TB culture, autoimmune serology, pro-BNP if you're not sure whether you're dealing with cardiogenic pulmonary edema, CT thorax if not sure. Other abnormalities, bronchiectasis is permanent dilation of those bronchi. You can see it on a chest X-ray. The most common cause in our setting, post-infective, post-TB, but remember post-pertussis can also do it. Obstruction of the bronchus can do it. Cartilaginous, your immotile cilia syndromes, okay. Hypogammaglobulinemia, ABPA, okay. Your connective tissue issues. Aortic pulmonic fistula, very rare. And CT thorax is the next thing you want to do. If your chest X-ray is normal, you got one of a couple of approaches. You can either observe the patient. If the hemoptysis persists, you want to go ahead and get a CT or a bronch, or you can give the patient a trial of antibiotics. If there's still persistent hemoptysis, consider CT and bronch. That can either be abnormal or normal. If it's still normal, consider pulmonary embolus, pulmonary hypertension, of which there are 5 flavors as per the WHO classification, or pulmonary endometriosis, which can cause something called catamenial hemoptysis. Remember, if you got hemoptysis together with hematuria, you're thinking about anti-glomerular basement membrane disease, Goodpasture syndrome. Okay, this is a joke for you guys. I tried playing hide and seek in the hospital. They kept finding me in the ICU. Joke. Okay, everybody, Matthew 11:28 to 30, Jesus gives us a beautiful invitation. This is what he says: Come to me, you who are weary and burdened, and I will give you what? Rest. Take my yoke upon you and learn from me, for I am gentle and humble in heart, and you will find rest for your souls. For my yoke is easy, my burden is light. Amen. We need to learn gentleness and humility by being yoked to Jesus. And then he gives us his rest. What a beautiful place to be. Amen. I'll see you soon with another handy video. God bless you.